I'm Dr. Ophelia Cabral.
And I'm Thomas Cabral. Welcome to Healthful Living. Today we're going to continue our discussion of panic attacks. We're going to focus mostly on the treatment, but before we do, Ophelia, can you just give a little recap of what a panic attack is?
Talking about panic attack means talking about fight, flight, freeze response. Fight, flight, freeze response, or in short, fight, flight response is a software, if you like, or alarm mechanism. Works only in life and death situations. So every alarm mechanism designed to a certain task. Fight and flight mechanism designed to save us from death, basically. It's very important for our survival. So fight and flight response is function of one of the autonomic nervous system's function. And fight and flight response, if works when your life is not under danger, we call it panic attack. Like if you have a big truck coming over you, coming towards you, and then fight and flight response kicks in and saves your life, that's the purpose. But when you're sitting in your living room playing with your phone and then fight and flight response kicks in, that is called panic attack.
And that's when you're really freaking out because you don't understand what's happening. You're thinking you're dying, your chest is pounding, you're having a heart attack, you can't breathe, your mind is racing, you feel like you're losing control.
Yes.
So it's not a disease. A lot of times people talk about panic attack as a disease, but we're talking about a normal function of the body, just an overactive alarm system, so to speak.
Yes, I couldn't agree more. If you like, we can say it like that. It's a thief alarm, works when there is no thief. But it doesn't mean that alarm is faulty. Maybe alarm needs a little bit adjustment, that's all. Alarm is still working, but out of place. So it's not an illness, you're right.
So it's an old system, so, life was different back then, so you needed this system, we still do, but the threat in today's world is a lot different. Yes. So it's not like, a beast coming at you, it's maybe the fear of losing your job or maybe a divorce happens or something where it threatens your livelihood, and that alarm system will go off at that time. But because we don't connect it to what's happening in our lives, it becomes this traumatic event in our minds. So with that said, how do we treat this? What's the treatment for panic attack?
Good news is there's a treatment for panic attack, and better news is doesn't involve medication unless absolutely necessary. To my opinion, is working in general practice area as a general practitioner more than 30 years, patient giving information to the patient is the most important thing. In panic attack, in diabetes, hypertension, name it. But knowledge is half of the treatment, and it's same with panic attack. And in panic attack treatment, we need to treat conscious mind and unconscious mind at the same time. And if you do that, then 95%, close to 100% success.
So that's very good news. Now you had panic attack for 20 years?
Yes.
And so let's talk a little bit about medication. So you were on medication for quite a long time, weren't you?
That's true.
So what is the role of medication? Because it's usually the first line of treatment in normal medicine, let's say.
That's right.
So what's the role? What kind of medications are we using, and what's the purpose?
Of course, there is a place for antidepressant medication in panic attack, but it's very small place. It's like if patient cannot function, cannot do daily activities like going to school, going to work, staying at home, going out or by him or herself, just daily functions. If they cannot do it, then in a short while, like not more than 3 months, we give antidepressant medication to settle down the symptoms a little bit.
So you're reducing the intensity of the panic episode.
That's right, reducing the intensity of the symptoms so patient can do their daily activities. How can we do that is antidepressant medication works at many levels, like changing the electricity, chemistry, magnetic energy in the brain. But let's talk about the chemistry or electricity. Antidepressant medications, especially nowadays, third generation antidepressant medications are very strong. You know, after a week of use, it can reduce your attention 30%. Oh. So that means we slow your brain's electrical activity to control the symptoms. In a way it is good, in a way it is not. So we use antidepressants till therapy catches up.
So it's originally meant for short-term use.
That's right.
But it's also very common in traditional medicine where you have people on these medications for 5, 6, 7, 8 years, and as time goes on, they need more and more because you build up a tolerance to the medication. Is that correct?
That's right.
So
your body's defense mechanism kicks in after 3-6 months of use and develops antibodies to antidepressive medication molecules. So it doesn't work when you started the medication at the for the first time. But most patients don't know that.
Yeah, so it becomes this, vicious cycle of always more and more of an increase. At some level, the clients know it's not really helping much, but they're afraid that if they give it up altogether, then the panic is going to come back more severe.
Yeah, which is called psychological dependency on antidepressive medications.
So it's treating the symptoms, but we really need to treat the cause, and that's right. Where your therapy comes in.
Exactly. After 20 years of panic attack, I had this treatment, one-day panic and wave program, and it's 21-day program. You spend 1 day at the clinic and 8 hours of information, knowledge about panic attack, and you put all the pieces in your mind together in that 8 hours. It's very important. It had to be in 1 day. As an experience, so you put all the pieces, that's what I experienced, and that's why I experience, And then 21 days program, training your conscious mind and unconscious mind. Those 21-day program involves 3 steps: invitation, 7-11 breathing, and USB program. And if you have any symptoms during that 21 day, you ask for more, which I think you can explain it better because you love that.
Okay, so the information part is for the conscious mind.
Yes.
Right, and then like the hypnosis CDs is
yes.
for the subconscious mind.
Yes.
Also, when you do the invitation, you're actually working with the subconscious mind, teaching it, resetting the subconscious mind, so to speak, correct?
That's right. Teaching the unconscious mind that there is no imminent threat to life. Yeah.
So how do you do this invitation? What's this invitation thing about? Do you send, little cards and you mail them to?
If you like, you can do that. But every word we know have conscious meaning and unconscious meaning. So invitation, if you invite something, unconscious mind takes it as, oh, this is not a threat to my survival. So when you invite panic attack, unconscious mind automatically codes it as, oh, this is not a threat. So when unconscious mind, like, this is not a threat, so it doesn't stimulate adrenaline secretion.
So, like before, there was this fear, what if the panic attack happens again? And that was causing the stress and feeding the vicious cycle.
That's right.
So by inviting it, you're basically saying, look, I'm not afraid of this anymore.
Yes.
And so then the subconscious mind doesn't trip the alarm.
That's right.
Now, so what do you do? When do you do it? When do you invite it?
The best time is in the morning. As soon as you wake up, you invite panic attack, you know, out loud or inside your head. You can use the word invite or not. Unconscious mind knows it. You know, it's like, come, I'm here, is an invitation.
So you wake up in the morning, you're like, today I want to have a panic attack. And you just can't have it because the mind registers it as no threat.
Yes.
Now, in my experience, sometimes what happens though is it's not like you were a panic attack for 20 years.
Yes.
So when you have it for so long, it's hard to believe that this could work. It's simple and effective, but you know, for 20 years you could never make it go away. So
That's right.
my experience is sometimes it doesn't happen often, because when a person truly understands, right, then they invite it, you can't have the panic attack. Yeah. But sometimes people are like skeptical. I know I was in the very beginning, like, this is too good to be true, right? so you invite it, you know, like, yeah, I want to have a panic attack today, but you kind of get your fingers crossed behind you. You're like, I hope it doesn't come at some level. So usually what happens, you know, so the subconscious mind, the way I understand it, is perceiving it as a bit of a threat. And so it will start to initiate the alarm system. Now, it won't be at the same intensity because there's that, it's not the same intensity of fear. So you'll have a little reaction. So then that's when you welcome it. So now it came, and now you can't do anything about it anyway, so you welcome it.
But very little intensity.
Yeah.
Yeah.
And you'll start to feel things, and you just sit through it, and you just observe it, and you start to realize that this isn't going to hurt you. So then you get your confidence back. And then, you know, ask for more. So now you're like, oh, my heart's beating fast. Okay, this is part of the panic attack. This is normal. I want more. I want more, a faster heartbeat, more intense. I really want to see how bad this thing could get. And again, subconscious mind says there's no threat here. This guy's kind of crazy. I mean, you know, and it can't deliver.
Also, there is a neuroscientific explanation for it. Like, if we experience any symptom at any time in our body, that means we have some molecules, chemical molecules, to support that symptoms. Like if you have racing heart, let's say 120 per minute, so you have this bit adrenaline supports 120 per minute heartbeat at that time. Even though you ask more, you beg more, doesn't matter, you can't have it. Because it's very mathematical, very chemical at the same time. So panic attack patients usually very fearful of if my symptoms gets worse. And asking for more stops that fear, because as they ask more, they cannot have more mathematically. It's not going to happen.
So simple, right?
Yes.
But it works, you know, from experience.
And breathing technique also supports the whole program, actually. 7-11 breathing is the second step of the program.
So how does that work? What's the, well, it's like you say, it's 7-11, so you're breathing in the count of 7 and you're breathing out the count of 11.
Yes.
So it goes something like this, you know. I'll demonstrate it.
All right.
So it'll be...
Great. Awesome.
Thank you very much. So ideally, you want to do it in through your nose and out through your nose, but sometimes people have sinuses and all, you could do it through your mouth. I did it through the mouth, so you could, it's easier to demonstrate.
That's true.
So you breathe out more than you breathe in, and what's the purpose of that? What does it do?
So, as you know, breathing techniques, there are lots of breathing techniques, but we can change your chemistry in terms of seconds, adjusting the inspiration and expiration time.
Exhalation time is longer than your inhalation time. Basically what you're doing is you're activating the parasympathetic nervous system. And now that's the common part of the nervous system, because you have the fight or flight, but then when the threat's over, you need a way of calming the body down. One's to prepare you and the other one's to calm you down. So you can actually initiate that response, that calming effect, just by doing that breathing.
That's true.
Now, sometimes in the very beginning, what happens is I mean, your chest is tight when you're anxious. So it will seem hard at first. Well, not hard, but you know, it's a little awkward at first.
Yes.
Right? So what you can do is you could, if you can't do 7-11, then you could do 5, inhale 5, exhale 9, or breathe in 4, you know, exhale 8, right?
Yeah.
And what happens is, as you do that, your body starts to relax, and the muscles in your chest relax, and then you get a better breath, and then it becomes easier and easier. Then 7-11 breathing, it becomes so simple.
You're right. To relax, you need to have certain cocktail of brain chemistry, you know, and 7-11 breathing does that. And also, 7-11 breathing facilitates the coding in your brain. Coding of this program is permanent, like recent studies shows that minimum 5 years that program stays in your brain if you do the parasympathetic system supporting breathing, like 7-11, like 5-8, like 4-8, you know. So it's a very important piece of this program in this regard.
Now, when do you do it? How often do you do it?
That's a very good question. In the morning and in the evening, and average person is 70 kilogram according to orthodox medicine, and 70 kilogram of a person, if 7-11 breathing 11 times in the morning, 11 times in the evening, supports the coding in the brain and also relaxes you because it supports parasympathetic system.
Okay, so I'm 95 kilos. So I should breathe a little bit longer.
A little bit longer, like at least 13 times in the morning, or 15 times in the morning and 15 times in the evening.
So what you're doing in the morning, you're starting your day relaxed.
Yes.
And if you do it at bedtime, then you're actually starting your sleep time in a relaxed state.
Yes.
So you're actually going to fall asleep quicker and sleep better, because you kind of activated the parasympathetic nervous system, right?
That's true.
Now,
so it works in many ways in your daily life.
So you could also do it, like, let's say it's midday and you're really starting to get stressed out at work. Right? You could take a few minutes and do this breathing, and you're going to, again, activate the common part of the body. Yes. So you keep your adrenaline level managed, stress management.
Yes.
And so then that in itself will prevent the threshold from being reached.
That's so true.
Okay.
So it works in many areas. And the third part of the program is USB program. It works in digital environment, of course, and it contains 6 CDs, hypnosis CDs, to train unconscious mind, and 1 DVD to train conscious mind. And there are certain days and times we use this program. So at the end of 21 days, you're going to be panic-free 95% of success with this program, because you train the both consciousness.
And you have a very hypnotic voice. So many people, what they do is they'll do some breathing, and then they'll put in the CD at night, and they'll listen to hypnosis, so they drift off into a very nice sleep. Because if you go to bed with an anxious mind, then you're going to have anxious dreams, you know, you're going to have anxiety in your sleep.
Circle.
It's a vicious circle. So by doing this program, you're training your body to relax, and after 21 days, it becomes almost like a habit, doesn't it?
That's true. That's true. And I think this is it for today.
Well, actually, there's
Okay.
we forgot one other piece.
What?
Actually, 2 things I'd like to go over. One is how does lifestyle changes come into play with this?
Lifestyle changes is, of course, very important for panic attack people, for everybody, but especially for panic attack people, when we say lifestyle changes, what we eat, how much exercise we do, quality of our sleep, they all comes to the field. So in general, what we need to eat, or what we refrain from eating, is carbohydrates, refined sugar. You know, everybody needs to refrain from carbohydrates and refined sugar, or at least decrease the level of refined sugar and carbohydrates, and red meat if possible. Moderation is the key, what you eat. But
why red meat?
Because red meat also it contains a lot of adrenaline, and
true.
It's hard to digest. So when you eat a lot of red meat, it stimulates the sympathetic part of central nervous system, which we don't want it in panic attack.
Now, what about exercise? What kind of exercise?
Walking is good, but any exercise they like at least 3 to 4 times per week. What exercise does is many things, like exercise burn blood sugar, burns adrenaline in your blood. Exercise allow your brain secretes a lot of relaxing hormones. So you know, it serves you in a many different way.
And it's actually really important with panic attacks, because again, what is the fight or flight response? Right? There's a threat, your body wants you to take an action. So you're either going to fight or you're going to run,
Yes.
right, and escape the danger. So in today's world, right, the stresses are different. So when you have a panic attack, right, and you're at your office, right, you can't just get up and run. And you can't start throwing around furniture or anything. You can't do anything physical.
Yeah.
So your body needs that physical to discharge the adrenaline. So
Yes,
again,
burns the
if you're doing the
adrenaline.
7-11 breathing and you're exercising regularly, then whatever adrenaline you have, right, you're working that out, so to speak,
Yes.
right? And then the endorphin kicks in and you feel really good.
What you eat is also very important, because your body takes, let's say, refined carbs, refined sugar as threat. Because what happens when fight and flight response kicks in, your blood sugar goes up to the ceiling. So when you have a lot of sugar, your body takes it as a threat. What's going on, you know?
Now, when you say carbohydrates, we're talking, there's some good carbohydrates.
Yes.
Meaning they burn more slowly in the body. They're more of a balance.
Like complex carbohydrates.
Complex.
And organic carbohydrates, and
Like fruits and vegetables.
fruits, vegetables, potatoes, rice, you know, but the refined part of it is the problem.
Okay. Now, also you teach like hobbies, and I think that's very important to engage in some sort of hobby. And well, why is that?
Because body and mind is one. When mind calms down, it reflects on the body. So with hobby, we train mind, focus on one thing. When you focus on one thing, especially if you like doing it, then your brain wave goes to alpha 1. So it's very calming.
Hypnotic almost.
Hypnotic. Like lately, we are into orgonit.
Yeah, that's true.
You know, how calming it is. You know, when we focus on creating something, it's joyful for us. You know, all our attention is there. We don't think about anything else. Then it's very calming to brain.
And if you're engaged in a hobby, then you're not, because very often when people they get home at night, right, and they really don't have a hobby on a thing, so all they do is they focus on like their bodies. They become obsessed with their bodies and, constantly
Symptoms.
checking, right,
Yeah.
symptoms, and, out of habit, basically. So again, it's another defense, right, or another preventative way of, preventing panic attacks, and also it gives you joy.
And also promoting healthy living.
There you go. One last question. So now you went through the program and you get to the root cause and you don't have panic attacks anymore, but you still have this medication that you've been taking. So how do you handle that? How do you what do you do to stop people who's been on medication for years?
It's a very good question. And after 21 days, with the doctor, a general practitioner, or with their psychiatrist or psychologist, they need to taper it very slowly. If it is long time use, especially, let's say 5-6 years time use, then it has to be weaning off in 6 months.
So you're on what's a high dose? 200 milligrams?
It depends on the molecule.
Well, no, I know. But what I'm saying is, so you're on 200 milligrams. So give me an idea of like you would cut it by 25 for a week, and
that's right. More than a week depends on the patient's response to it. Like every 2 weeks is ideal to reduce the dose, but again, it has to be tailored on personal level with the doctor. They used to go, and the doctor, general practitioner, they know how long they use, how their body responds to medication.
So, and if you just cut it short, it's like you could go into a withdrawal. It's like a crash.
Yeah, a lot of intense symptoms they may experience, and when they experience those symptoms, they automatically go back to medication, so it's a vicious circle again. So they think that, oh, I cut the medication, I cut off the medication, and then, I have these symptoms. Actually, it's not the case. The case is if you stop medication very suddenly, then you will have a lot of symptoms because your body is used to have those molecules to function in a daily life. So same thing happens with when we ask people decrease your sugar level in your diet, and what happens? They go withdrawal.
Oh yeah, that's true.
So what we do is we decrease even sugar, very slowly if they are high consumption of sugar in their diet. So same thing with these antidepressant molecules. We need to go really slowly, not to induce any withdrawal symptoms, because any withdrawal symptoms, patients go back to antidepressants.
That's great. Well, there you have it, folks. You understand what a panic attack is. You know that it's not an illness or a disease. It's something that can actually be cured, something that has, the light at the end of the tunnel, basically.
Yes.
I appreciate you sharing your knowledge with us today.
Thank you very much for hosting me.
Next program, we're going to talk about trauma. And panic attack, interestingly, is a symptom of trauma. Trauma is a really negative experience. We'll go into detail. As we go through our programs, a lot of these things are going to, I'm sorry, hold it. As
overlap.
A lot of these things are going to overlap. So as we talk about other things, you'll be able to apply it in panic attack and different problems as well. So thank you for listening, and we hope you have a wonderful day. Take care.
Bye for now.
Wow.